want to do anything without a regulated nervous system. And that is what we preach to our patients all of the times of like, we can't control everything, but what we can control is that your nervous system is ready, right? It's ready to go into battle. It's ready to go into this marathon of birth. And it's ready to adapt to anything that you need to do. And it's ready to receive that perfect baby that's gonna lay right on your chest so that you can help regulate their nervous system.
All right, chiropractors and chiropractic students, welcome to the Family Practice Podcast. You know, the one you've been waiting way too long for, because this podcast will actually stay focused on chiropractic, not only what it takes to get world-class clinical results for kids and families in your community, but also what it takes to build a legendary, incredible family practice that takes care of your family way beyond your dreams. I'm Dr. Tony Ebel, and I'll be joined by Dr. Matt Hill, Dr. Allie Wright, Jackie Jacobowitz, and incredible guests, chiros, associates, CAs, all these folks making massive impact around the world. We're going to cover everything: pediatrics, perinatal, family practice. This is the podcast you've been waiting for, because moms and dads and families have always needed us. Now they're finally ready for us. I hope you're ready for the Family Practice Podcast. Let's go.
Hey everybody, welcome back to the Family Practice Podcast. I am so excited that you decided to join us today. I'm your co-host, Dr. Allie Wright, and we're going to be diving into something that could completely transform how you care for your pregnant patients. And guys, we're getting really nerdy today. We're going to talk all things heart rate variability, or HRV. If you don't know what that is, that's all right. You'll stick around and learn with us. And then if you're not measuring HRV in your pregnant patients, we extend grace. Don't worry, we're not here to judge, but you better start doing it tomorrow. Okay. So, to start, let's begin by talking about what even is HRV. What's heart rate variability? If you're listening to this podcast, we should probably start by telling you what heart rate variability is. So, we have this awesome technology, and what we use it as in our office is the neurological insight scans. There's 3 of those. One of them is heart rate variability. How we test heart rate variability is that you either wear a little clip on your ear and it's going to measure your heartbeat for 3 minutes, or you're going to stick your hand and it's going to pick up your heart rate from your fingers. You stick your hand in this little tiny machine. For those of you who are not watching and are just listening, just close your eyes and picture what I'm describing. But you stick your hand into a little tiny slot and you leave it there for 3 minutes, and that's going to collect your heartbeats. What heart rate variability is it's taking the number of time that's in between each heartbeat and it's averaging that. Why do we care about that as chiropractors? Is that it is testing the nervous system, right? Because what controls your heartbeat? Your nervous system. Exactly. Good job. Hopefully you got that with that little tiny pause I gave you to answer the question. But it's your nervous system. That is what controls your heart rate, your heartbeat, all of those good things is your autonomic nervous system. And as chiropractors, that is what we impact the most. So let's dive in here. I absolutely love how Dr. Lindsay Matthews Cantu describes this. She says that your HRV is like the range of motion of your nervous system. Absolutely love that quote. I use it all of the time. And what we mean by range of motion of the nervous system is that everyone should be able to go from running from a bear or having a hard workout, having a hard day at work. Maybe as a chiropractor, you saw 100 and some patients that day. That's going, right? That's getting it. You are in your fight or flight mode, or like that gas pedal mode. You're just go, go, go. But then when you're done with that day, you should easily be able to go from this side and that, working really hard to now you're flowing to the opposite side. That's that range of motion. You're going to the opposite side and you're able to just down regulate. You're able to heal. You're in growth mode. You're able to relax, digest, reproduce. All those things happen on the parasympathetic side of the nervous system, the brake pedal, the rest and digest side. So every single person with a regulated nervous system should be able to go from that hard day of work, come home, and flow. It's just this constant flow. You're testing that range of motion of the nervous system. That's what your heart rate variability tells us as doctors. So if you're not taking that, it is very, very important. I want to tell you a story about one of our patients. She's my girl. She's awesome. But before she started coming to PWC, she was at another office. She actually worked there, and she had 2 pregnancies there, 2 beautiful kids, awesome pregnancies. But her doctors were focused on more of a musculoskeletal route, more of round ligament pain and back pain and sciatica, which are all very important things. But what should we be focused on the most? It's the nervous system, because mom's nervous system directly correlates to baby's nervous system. So one of our patients, she was had those 2 pregnancies with another doctor, awesome, but not nervous system focused. Then she came to us for her most recent pregnancy that she had, and I just remember her lighting up when she saw her scan, specifically the HRV, because she was so focused on, oh my goodness, this is my body battery. This is what it's starting at. This is exactly how I feel. And she was like, I'm not using that range of motion. I'm not able to go flowing from fight or flight and then rest and digest. What she was doing is just getting stuck on the gas pedal for nonstop so long, and she couldn't get out of that. And so what we did is, through her entire pregnancy, we were able to test not only EMG and thermal, but I'll also test HRV with our neurological insight scans and see, okay, what is she starting at in her first trimester to second to third and postpartum? Is she prepped for birth? Is she able to now have that regulated nervous system because in birth, guys, it's so important that we know that you have to be able to access the gas pedal and the brake pedal during your birth. So let's go through that really quick. When you are initiating birth, when your patients are about to go into labor, how you start labor, you have to be in that parasympathetic state. That's why we say, oh, go relax, go watch a movie, try to sleep as much as possible. It's because you are getting in that parasympathetic nervous system state. You are on the brake pedal. Your body feels safe enough to start labor. Now, once you get to the point where you have to push your baby out, not only does your gas pedal have to turn on, but your baby's gas pedal also has to turn on. So their nervous system is just as important for birth. Once baby gets out and mom is holding baby, they are skin on skin. That is where both mom and baby, mom is telling baby's nervous system that it needs to go into the brake pedal mode, the parasympathetic nervous system, where both mom and baby feel completely safe. Now, that is a perfect birth that I just described of how the nervous system flows, how it rolls. That being said, there are so many different things that happen during birth, right? Like we can't even guess what may happen during birth. I would love to see a peaceful home birth where everything goes perfect, but that's not always what happens. We can't control everything, but docs, hear me on this one. We can control how their nervous system is reacting or adapting to all of this stress that they see. And how we can catch that is through measuring HRV throughout the pregnancy. There's been so many studies done that have tested fetal development, and how they do that is testing baby's HRV in the womb. So I would absolutely love for that to be our next step, is taking those insight scans, hooking them up to a Doppler or something, and being able to test mom and baby's nervous system at the same time. But what we've gotten from these from all of this research is that we can see that whatever mom's nervous system is, babies usually mirrors that. So if you have a high stress patient, and they just are not adaptable, not resilient to stress, really stuck in that gas pedal mode, their HRV is completely tanked, that is where we're going to see a lot more complications come up in pregnancy and in birth. We've seen miscarriages. We've seen babies who are very premature. We've seen births not go according to what mom's dream birth is. And a lot of the times we can track that back to HRV. So With our girl, the patient that I was talking about, she absolutely had her best pregnancy was her third one, just because she was so in tune with her heart rate variability and knowing, okay, it's dipping down right now. How should I adapt to this? Do I need to get boost adjustments? The answer was yes. Do I need to, instead of going for a really hard workout, maybe I need to chill today? She was just able to adapt her life because she knew what her HRV was and she knew that her baby was mirroring that as well. So let's talk through the science of how babies' HRV is somewhat mirroring mom's. Really, baby's nervous system is learning through mom because mom is the blueprint. Her nervous system is the blueprint to teach baby what their nervous system and how their nervous system should function. So through the umbilical cord, a lot of the times we say that the umbilical cord is the power cord. And I've had some people ask, they're like, oh, well, does the umbilical cord have like nerves through it or any of that? And that's not the case. That's not what we mean when we say the umbilical cord is the power cord. What we mean is that yes, it is from mom to baby, the umbilical cord has the oxygen running through, it has blood supply, it has nutrients, but it also has hormones that are running through from mom to baby. Now, hear me on this. What controls hormones? If you don't know the answer to that or the science through that, go listen to the last episode we did, the last prenatal episode, because we talked through hormones and how the nervous system controls all of that through the HPA and HPG axes. But for today, let's just talk through how hormones can be passed from mom to baby. So when mom's nervous system is stuck on the gas pedal, she is in fight or flight, she's creating cortisol and adrenaline constantly, and she's passing all of that to her baby. Now, if her nervous system isn't resilient and isn't able to shut that off and go back into a parasympathetic or brake pedal side of the nervous system, she's going to continue to pass this on to baby, where baby's blueprint is now just constant gas pedal, fight or flight. Yes, they're already in the fetal position, but they're going to come out and stay in the fetal position for a long time because of these hormones, but because of the nervous system. We always give hormones, right? They're the star of the show. They get too much credit, guys. We got to focus on the nervous system and stay nervous system focused prenatal and pediatric chiropractors. But that is how baby is getting what mom's nervous system really is. So through testing their HRV, we're able to say, all right, mom, we got to boost those adjustments, or let's get on a bigger care plan, or through this trimester, let's see exactly what you need to do and let's rescan you in the next trimester. At our office, we scan every 12 visits, but for our pregnant patients, we also scan every trimester, so first trimester, second, and third, and we also scan immediate postpartum when mom's ready to come in and bring her baby. We will scan mom and baby together. We want to get their HRVs together to see how they are co-regulating. What do I mean by that? Let's go back to birth and how when mom pulled up her baby and they were skin on skin, mom's nervous system told baby how to function. That's the mom and baby dyad. That's the beautiful co-regulation of what skin on skin does, of what nervous systems communicating together does. We see often at our office when a kiddo is the only one in their family who's under care so far, and they're getting better and better and better, and then all of a sudden there's a plateau. We always say, all right, let's get your mom and dad and your siblings scanned because we want to see how their nervous system is functioning, because all of you are co-regulating together. You all live in the same household. You are doing things together. Your nervous systems are communicating. They're co-regulating together. So babies, they don't know how to regulate their nervous system yet, which is also why it is so important that babies get adjusted. But that's equally important why mom gets adjusted too. During preconception, hopefully, during her entire pregnancy, and during postpartum, both mom and baby together. So that's co-regulation. That's how we can see when we take baby's HRV and mom's HRV. And obviously we do need more research on this, but as we do it in our office, we're gathering so many touch points where we're like, okay, this is proving exactly what we talk about daily. over and over again, which is just chiropractic, right? We're always continuing to prove what we do works, just seeing blessings and just what the Holy Spirit has been doing at PWC and in all of these other PX Docs offices. The miracles that happen every single day is just, there's no words for it, but all of those stories continue to prove that what chiropractic and what God really has been doing through PX Docs, and it's phenomenal to see, but we have to put the nervous system first, and that's why we test HRV in our pregnant patients. I want to touch on the fetal development papers that we have been reading. If literally, guys, if you just Google fetal development and HRV, there's a few of them that come up, and they're fascinating. But what we're seeing is that there is I want to find this in my notes really quick. What we're seeing is that when a lower HRV for mom and baby, baby still in utero, what they have found is that just a lower HRV can, number one, go with fetal distress. Obviously, we know that as chiropractors, right? Lower HRV, you're going to have a higher stress level that you're not adapting to. Number two, what they've seen with a lower HRV is going to almost always lead to preterm birth. And that's not even with inductions or anything like that. That's just preterm. Something's going on, whether it's preeclampsia, high blood pressure before preeclampsia, whatever it may be, baby is coming earlier. And we've seen that with the lower HRV. There's also been the perfect storm. If you don't know what I'm talking about when I say perfect storm, it really is just this cascade of events leading to all of these chronic issues and illnesses that we're seeing in kids today. So that could be anywhere from the prenatal stress or fertility stress that mom and dad experience, and then they finally are able to conceive a child. They have multiple ultrasounds and appointments, nonstop stress, goes into the birth. Maybe they were induced. Then they got an induction, and then they got an epidural, and then that led to maybe some forceps, some vacuums. Maybe it led to a C-section, just so many different things. Then the baby is colicky, experiences ear infections, has reflux and eczema, grows up to get an ADHD diagnosis, and then we have allergies, and then, it's just this entire cascade of events leading to what we call the perfect storm. And they're seeing this. They're seeing this in utero. The baby has a low HRV, and then they follow them, and they're getting all of these neurodevelopmental issues. There's been a connection with lower fetal HRV and the increased likelihood of ADHD, like I mentioned. There has also been different cognitive and behavioral difficulties down the road. There's been anxiety and depression, and they're proving this through a lower HRV. And what do we do as chiropractors? We help the nervous system adapt so that, and regulate, so that the nervous system is more adaptable, is more resilient, which increases that HRV, increases the range of motion of your nervous system, right? And we are hopefully preventing these perfect storms. Now, again, I will say it 1,000 times, probably on every single pod that we do, we can't control everything. Right? There's so many things that can go wrong that aren't guaranteed, whatever. But if we have an adaptable nervous system, that's how I want to go into birth and postpartum and pregnancy and even preconception. I don't want to chance anything for myself. I do not want to go into anything we do with a dysregulated nervous system. It's just like, as a Christian, I'm not going anywhere without the Holy Spirit, right? It's the same thing. You don't want to do anything it's the same thing at a lesser scale, but you don't want to do anything without a regulated nervous system. And that is what we preach to our patients all of the times of like, we can't control everything, but what we can control is that your nervous system is ready, right? It's ready to go into battle. It's ready to go into this marathon of birth. And it's ready to adapt to anything that you need to do. And it's ready to receive that perfect baby that's going to lay right on your chest so that you can help regulate their nervous system. It's fascinating. And I hope that this has completely helped you understand why you need to take HRV and why you need to take HRV seriously. I absolutely love when a mom and baby get scanned together after we've seen this mom through pregnancy, and then we see their scans. And it's so cool to see either they match, their HRV matches. It's in the same zone. It has the same level of what we call battery. But there's also times where the HRV doesn't match. We actually had a baby and mom come in last week where baby had to be induced. We hadn't seen the mom. We just saw the mom from 35 weeks on. And that's a hard place to get patients to. Obviously, we want them to come, as soon as they can. As soon as they hear about us, we want to see you and your growing baby. That being said, we caught her at 35 weeks. She was breech, ended up choosing an induction, then did have an epidural. Mom said it was a little too late for that to even impact her, but that baby gets the epidural as well. And then baby struggled, and baby is still struggling right now. That's why we adjust babies, and that's why we adjust mom postpartum. And I'm so excited. This was just last week, so I'm so excited to see how she's going to recover. And she sees all of our doctors. They're all amazing. And it's just going to be so cool to watch her nervous system come back online. It's also so entirely important that her mom is under care too, because who most likely is regulating this baby's nervous system? Mom is, through co-regulation. So I'm really excited to hear more on that journey with them. Everyone is testing their HRV right now who cares about health. And it's amazing. It is an ultimate global health measurement of how are you adapting to stress. That's really what it is. So I hope that today we have totally and completely convinced you to start taking HRV in every single trimester in postpartum, taking it for both mom and baby, because guys, it is crucial. Read these fetal development papers because they are so fascinating. I mean, there's connections with SIDS, there's connections with so many different things, the neurodevelopment issues that we talked about and the perfect storm. And that's what we do. Right? And if you want to learn so much more on how to communicate HRV, how to take HRV, how to not just get a core score or a number with it, but to truly and ultimately understand all the realms of heart rate variability as chiropractors, you have to jump into the membership for the pediatric experience. I'm going to plug it. It has completely changed so many doctors, including me, every single week when we have that weekly call. We are diving in all of the modules that we have, the life cert that we have of that. It's amazing, the pediatric experience as a whole, but you're going to learn so much on how to scan. If you're not doing this now, guys, you have to jump in. Seriously, it will transform your practice. It'll transform results. It'll transform and show you exactly what you're missing or what you need to do. It is great and awesome to communicate the nervous system and to have an objective finding to show your patients, but we have to start doing it on our pregnant patients and showing them that this isn't about back pain, sciatica, round ligaments anymore. Is all of that important? Yes, I've been pregnant. I don't want to be in pain, right? But when we can directly affect a growing baby's nervous system through their mom, guys, that's the hands and feet of Jesus right there. Like, wow. When we can affect a growing baby by adjusting their mom. And don't hear me wrong. I love the moms. I am a mom. I advocate for moms every single day. But the baby, when we can fight and stand up for the baby and hopefully help prepare their nervous system for what they're going to go through, not just birth, but life. I mean, you saw the research, you saw the studies, or you heard them forgot this is a podcast. You heard the studies of those neurodevelopmental issues, starting with a low HRV in utero. And who's passing on these hormones through the umbilical cord? Who lays the blueprint? Mom does. Dad does too, right? Before conception and at conception, dad plays a big role as well. We have to be getting to these people so that we can prevent the perfect storm. All right, guys, if you want to find us at the Pediatric Experience, message us. You can find me on Instagram at Dr. Allie Wright. You can find all of our co-hosts on Instagram. You can find us really wherever you look. We're on YouTube. We're on Apple. We're literally everywhere. Instagram, Facebook. So if you have any questions, come find us. Dive into the Pediatric Experience membership. That is key. We also have CA courses, we have marketing courses and resources for you guys. It really is, if you want your dream pediatric and perinatal chiropractic office, you have to get involved with the Pediatric Experience. All right, thank you for listening. Again, I'm your co-host, Dr. Allie Wright, and this is the Family Practice Podcast. See you guys next time.
Hey, Dr. Tony here, and I wanted to say thank you for listening to the Family Practice Podcast. If you enjoyed this episode, like and subscribe to the show so you don't miss a thing. Also, if you're looking for more content from us, you can absolutely subscribe to our newsletter, watch exclusive episodes on YouTube, and dive deep into the articles and blogs on our website. All of this is linked in today's show notes. Thanks again, and we'll see you on the next episode.